Hello, welcome back to the final section of the Axial Spondyloarthritis module. We're going to talk all about pharmacology. So do remember again, there is an overview of pharmacology in the introductory module, and combining that with this one will give you a little bit more detail with regards to some of the drugs. We're going to talk specifically, remember, about axial spondyloarthritis here. There are, again, some differences in the peripheral spondyloarthritis module that you'll want to combine because you might see some patients on various combinations of different drugs, depending on what their presentation is, especially if they have sort of a peripheral and axial mix of diagnoses, or they have psoriasis on top. We're going to talk about anti-inflammatories, then move on to biologics, and finally just briefly touch on comorbidity medications that you might see as well. Anti-inflammatories commonly for axial spondyloarthritis, this is going to make up the bulk, especially of early management, but a lot of patients will just manage on anti-inflammatories long term. In my experience, approximately a third to 40% of patients will manage for their entire disease course on non-steroidal anti-inflammatories, and that can be quite effective rather than moving on to a biologic. As we mentioned previously, they can have an extremely strong response to anti-inflammatories, up to 80% improvement, and that is really quite useful. The problem, obviously, with anti-inflammatories is that they can come with a whole host of side effects with long-term use, so that does need to be considered. So over-the-counter type drugs, patients will often attend having already started these, that things like ibuprofen problematically causes a lot of gastrointestinal problems, unlikely to be used in the long term. A prescribed type medication would be something like naproxen or maybe diclofenac, and they are commonly prescribed by GP surgeries, and these can have some problems with gastrointestinal issues, but also very increased risk of cardiovascular disease, which when we've already got axial spondyloarthritis, doubling your risk of cardiovascular disease, that can be problematic.